Hi, everyone. I'm Ashley Bassett.
And I'm Catherine Logan.
And welcome to the Sports Talks podcast. On each episode, we chat about the most recent developments in sports medicine and dissect through all the noise so you know which literature should actually impact your practice. Today, we're coming to you live from the American Orthopaedic Society for Sports Medicine annual meeting in Washington, D.C.
The AOSSM annual meeting is the premier sports medicine conference each year, hosting over 3,500 attendees with hundreds of posters and paper presentations, exhibitors, and instructional course lecturers. This year proved to be as spectacular as years past. We were fortunate to have the opportunity to catch up with many of the presenters at the meeting and get their take on some of the hottest topics in sports medicine.
Over these 7 episodes, we're going to be exploring some of the hottest topics in sports medicine with these experts who are presenting at the AOSSM annual meeting.
We are supported by MEOC Orthopaedics. MEOC Orthopaedics is leading a shift in the treatment of anterior cruciate ligament tears from reconstruction to restoration with the Bear implant. Bridge-enhanced ACL restoration facilitates healing of the torn ACL. Unlike reconstruction, the Bear implant does not require a second surgical wound site to remove a healthy tendon from another part of the leg or the use of a donor tendon.
The Bear implant acts as a bridge between the two ends of the torn ACL. The surgeon injects a small amount of the patient's own blood into the implant and then inserts it between the torn ends of the ACL in a minimally invasive procedure. The combination of the Bear implant and the patient's blood enables the body to heal the torn ends of the ACL back together while maintaining the ACL's original attachments to the femur and the tibia. The Bear implant is resorbed by the body as the ACL heals. To learn more about the Bear implant, including clinical study results and instructions for use, visit www.bearimplant.com.
We are joined today by 2 outstanding guests. Dr. Robin West is the chair of the Sports Medicine Service at Inova Health and team physician for the Washington Nationals. She serves on the board of director for the NFL Physician Society and NFL Scouting Committee. Dr. West is also program chair this year at AOSM annual meeting and did a phenomenal job ensuring that educational and engaging program was delivered.
We are also joined by Dr. James Voos, Chair of Orthopedic Surgery at University Hospital in Cleveland. He is also the head team physician for the Cleveland Browns and the president of the NFL Physician Society. Dr. Voos has published extensively on the use of wearable technology to track players' workloads and medical stats in an effort to keep our athletes safe. So we're very excited to have him join Dr. West for our discussion today on the newest technology available to reduce the risk of injury and optimize performance. So without further ado, let's get to the exhibit hall. So, Robin, James, thank you so much for joining us for this special episode live from AOSSM annual meeting in Washington, D.C. Welcome to our show.
Yeah, thank you both. So you've spent much of your orthopedic lives working as team physicians, both of you within the NFL, and a very big and history. Robin, you were with the Pittsburgh Steelers and then the Washington Commanders, and then James with the Cleveland Browns. Over the years, there's been increasing focus on players' health and safety. Today, we'd like to dive a little bit more into specifically talking about how the evolution of technology has been presented to reduce injury risk as well as to optimize performance.
So many of these advancements that we're going to talk about are possible because of extensive data collection and analysis, so we'd like to start there. So James, can you tell us more about data collection in the NFL? It doesn't seem like it's just counting injuries anymore. It seems a little bit more refined than that. So how is this data amassed and how is it analyzed?
Yeah, this is a really unique environment to be in. And first of all, I wanted to thank you for the invitation to be here. It's wonderful to be on your podcast and to be here with Dr. West here. So we're very excited to be here. The NFL has really created a really unique environment where there's support of the organization, the interest of the players, and a really well-organized physician group that has really changed from reacting to injuries, as you see on TV, to being much more proactive. And that boils down to, or goes back to, creating an injury database or an EMR for the NFL, so everything that's done at the NFL level is documented, and then utilizing our technology, our wearable technology, all of our performance devices and technology to predict injury and really move towards player longevity and long careers versus reacting to each individual injury.
Yeah, so you spoke a little bit about wearables, and I know you've published on this, specifically thinking about radio frequency identification tags, or RFID, embedded into equipment. So Robin, you have a long history with the NFL. What did you see when that changed, when there started to be more of that technology integrated?
Yeah, it obviously has changed, significantly. Early in the past 5 to 10 years, it's made a big increase. And when I first started in the NFL in 2003, I mean, we didn't have any of it, right?
Yeah.
So we didn't really track injuries. It was all paper and pencil, and that was it. And so it has changed dramatically. It's changed from nutrition side, from tracking hydration, looking at osmolarity of sweat, doing really basic things, and then looking at concussion, looking at acceleration, deceleration, impact, looking at injury, again, how the injury occurred, injury prevention. So it's helped us as far as the rehab, as far as the preventing injuries. And then also all the video. I mean, having wireless microphones to communicate and wireless headsets, that has changed dramatically. I remember when it was wired and we were tripping over each other on the sideline and trying to run on the field and dumping our headsets, and now it's wireless, and so now we can communicate. So if we see something, or a player even sees something, players are now aware, right? So players come up to us and say, hey, listen, something looks a little off, or they're not reacting like we normally see them. So I think that allows a lot of communication.
Yeah, anything to add?
To add to the update of the equipment, now with all of that RFID information, we now know what the ideal surfaces to play on. Each player gets his feet scanned, so we know what the appropriate shoe to wear is, and then the shoemakers have now altered the shoes to prevent those injuries like turf toes and fifth metatarsal fractures. And now this year, for the first time ever, moving into more position-specific helmets, knowing that each player position may not need the same type of helmet, and you'll hear this year about a lot of the quarterbacks having an increased thickness on the back of their helmet to prevent if their head falls back onto the surface. So it's really been great to really dial into every player is not the same, using that technology to really customize the player safety for each and every athlete.
Yeah, you're hitting all the points you want to hit about every single one.
You can see we're getting excited.
We're so excited. But before we go down that route, I do want to talk a little bit more about the use of data for rule changes in the NFL. We were reading up on this, and the kickoff rule mainly was changed because of RFID data, correct? That they saw that people were building up this momentum and hitting players in higher risk of collision injuries and concussions. What kind of rule changes have you seen that have led to really notable changes in injuries in the NFL?
Now, this is really credit to the NFL, the Players Association, and the physicians all working together, knowing that the player is at the center of this. And seeing that data, you can see particular positions such as the wall buster that used to be on the kickoffs, and it's our return to play after a concussion, how we evaluate a concussion, our rules for heat and hydration, and we know all those different practice rules. And using our GPS data, we could see during the first 3 to 7 days of training camp is when most of the soft tissue injuries occur. We've been able to provide those recommendations to change the first week of training camp. If you can imagine back when we first started sports, the first week they would try to see what you're made of, and everybody's really struggling.
Yeah.
Now we know that acclimation and that build-up process is very important, and that's all come from the data that the NFL has adopted universally for rules changes. And even the way the quarterback is hit and protecting the quarterback are all things that each of the wearable data as well as the new camera data has really helped us.
So this is more of like a backup, big picture question, but why do you think, to be frank, that they listen to the physicians as a league? Like, what do you think the paradigm shift was from being reactive to injuries and focusing on treatment to saying, yep, because it's a big investment, financially, time-wise. I'm sure there's a big increase in the staff you had to employ. Why do you think the NFL decided, okay, this is really important and we should implement this stuff? Robin?
But it's all about time loss, right? And the financial impact. So you have a quarterback who's down and you miss a game, right? That's a much bigger financial impact than hiring 10 more people on the medical staff to help prevent injuries and help them recover. So I think that it really comes down to the financial side. And again, that trying to keep the players as healthy as we can to keep them on and playing.
Yeah.
And I think also, Catherine, it's listening to the veteran players coming back and talking about what life is like after football.
Interesting.
And having everyone really realize the NFL, everyone wants to see this to be they really consider it a family, and how do we make sure once you leave the game you have a productive post football life. And so all of those have really come together. We've had wonderful leaders from the NFL Physician Society who have really pushed this forward as well, and thankfully everyone is on the same page, and I think it's resulted in healthier athletes here and hopefully longer playing careers for each of our athletes.
Well, you mentioned seeing kind of what comes after NFL career, and the big thing everyone always talks about is CTE, right? The consequence of concussion, which highlights the importance of wearing good helmets, right? So we'd like to transition the conversation into that. So how is the NFL making sure that players are wearing safe helmets? What does the testing protocol look like? And how are they kind of promoting development of better helmets for the future?
Yeah, actually, that's probably one of the best questions that has come up, or the biggest examples of things that have come up in changing technology in the NFL. And you can imagine, up until just a couple years ago, the helmet was designed to prevent skull fractures, right? You go all the way back to Teddy Roosevelt time, and football was getting a bad rap because people were getting their eyes poked out and skull fractures. So a helmet, up until just a few years ago, was a fracture device.
Yeah.
And these are the first. This is the first time that helmets have been developed to reduce the impact from head injuries. So that paradigm shift there really changed how the helmets were manufactured. Then the NFL started testing every single helmet, and every year we have a ranking that comes out of how the helmets grade in that testing. So at first they were recommendations, and now you have to wear a certified helmet to be in the NFL. Then they've also done some technology prizes where they've funded different companies who have developed unique helmets. So they've really hit it from different parameters, and then have the players wear them and see if they like them. And I think the players feel safer utilizing them as well. So it's been a great partnership, and probably one of the best examples of how technology has changed the game.
And it makes sense, you noted position specific, that we're going to learn a little bit more about that this year, that, we think about position specific equipment in a lot of sports. It's not, it just makes natural sense. And it sort of, when you say it aloud, you're like, why hasn't that always been a thing? For helmets, it makes a lot of sense. Can you speak a little bit more about the specificity of helmets for position and what we're going to learn about?
The video data and impact data from the players has really shown that different positions, linemen, for example, have a lot of repetitive face-on, repetitive, maybe subcritical impacts over and over and over again, whereas a wide receiver or a running back may get hit on the top of their head or the side, the quarterback's falling back and hitting their head on the back of the ground. So each of those have allowed the helmets to evolve to fit that position. And interestingly, with that will also be a change in shoulder pads and thigh pads, because something is hitting that helmet, and it's usually a shoulder pad or another helmet. So it's also looking at both sides of the equation, where shoulder pads and your leg pads are also going to evolve with it as well.
That's great.
I think that the other thing to think about is that these head injuries are not always impact, right? It's acceleration, deceleration, and so looking at the weight of the helmet, the weight of the equipment, and so using that video analysis or the RFID tags to look at their speed, their acceleration, deceleration.
So we talked a little bit about helmet and concussion injuries, but what about kind of other types of injuries? And you talked a little bit about shoe wear and making sure they're wearing proper shoe wear and safe shoe wear, but first I'd like to talk a little bit about turf fields. So there was a letter that came out from the Players Association drawing some concerns about turf fields in certain stadiums. What are your thoughts on the impact of turf on injury and how to keep the players safe?
I think it's a combination. I mean, the NFL has done so much research on the footwear, right, and the flexibility of the footwear, the kind of footwear, and then also the surface, right? Is it grass? Is it turf? Is it new turf? Is it old turf? So there's a lot of things that go into it. But again, in combination with the shoe wear, and the shoes are ranked also. James, you can correct me. But again, they have the top 10 shoes to wear on this surface and that surface.
Yeah, the shoes get the same ranking as the helmets do. And I think the overarching theme with the surface of picking grass versus turf is less that one better than the other, and more standardization. When a player steps on the field, do they have a consistent standardized surface from game to game to game,
right,
from practice to game? Because there can be bad grass, there's good turf, and there's all of those in between. So I think the functional, practical name of the game is standardization of the surfaces. That way the shoes that are on those surfaces and then the surface the player can expect, I think that's the universal theme, or the collaborative theme that helps you decide, because there are a lot of parameters as to whether a facility needs grass or turf, and so that standardization, I think, is probably the best term to utilize.
And weather and heat and cold, I mean, all this stuff plays a fact, right? It plays a role.
Yeah, I think that's tricky. I guess I also wonder when you talk about this attention towards being preventative, looking at equipment, doing all these technology implementations, are you seeing that being very standard across the different organizations because it's coming from leadership down, or is it still maybe there's a little parity?
I think it's pretty standardized across the NFL, but across the other sports I cover, it's not quite as standardized. So each team will have their individual things that they're looking at, or assessing different injuries, but it's in the NFL. It's pretty standardized across the league.
Yeah,
what's followed.
I would agree with Robin. The NFL's done a really nice job of standardizing the equipment and standardizing our protocols. And fortunately, we've been able to be in positions on the musculoskeletal committees and the leadership committees at the NFL Physician Society, where we've been able to be a part of these decisions. And most important, we can take and translate them to the high schools and the colleges and the youth sports we take care of. And for us, I feel like that's one of our most beneficial ways to impact the communities. The NFL has all of these resources that have allowed us to come to these conclusions and to know what the better way to practice is. Now we can go back and tell all the high schools we take care of, here's this same helmet list. Your 15-year-old kid playing should have the same safety recommendations that the professional athletes.
So I think in some of the other major sports organizations, so outside the NFL, that there's a little bit of like, no, this is my secret sauce. I don't want to share it. This is going to help my team get to the championship. So I think, and congratulations on your new leadership role with the NFL. But I think that speaks a lot to the organization that it's okay, yes, this could help my team sort of gain an edge, but the most important thing is player safety. Optimization of their performance is great, but we also want to make sure it's
a huge push, I think, in education and getting the information out there. And our patients always come to us and ask us, right? What are the professional athletes doing? What's the NFL doing? And so I think from the recovery standpoint as well, at least on the NFL side, and how do we recover from concussions? What are we doing? Are we? And so using virtual reality, using the eye scanning techniques.
Ooh, talk more about that. Yeah.
I mean,
Tell us more.
I mean, the VR stuff is interesting because it can be used to practice safely, right? So it can be used for a player maybe who's injured to practice safely, or it can also be used for an uninjured player, a quarterback trying to read defenses or whatever it is. But on the concussion side, we do an eye tracking system, and so we'll use it for preseason, and then if they have a concussion, then we look at after an injury, and again trying to train them and condition them, even after an ACL tear, an ankle sprain, even something like that, because again we know that our VOM system is off, right?
Yeah.
And so if we can get that back.
And we know that data that if you have, you're recovering from some sort of concussion, that your lower extremity risk goes up. So it makes a lot of sense. What were you going to say?
Oh, no. But I do want, you brought up something I think is really important, is that all my community athletes are always saying, well, in the NFL they're doing this, everything from like biologics, they're injecting this, can we do that? What's the data behind it? Something that gets brought up by players and patients, parents all the time, is hinged braces to protect against ligament injuries, specifically MCL injuries. We actually did an episode on this from the AOS meeting, right, with Brian Waterman, looking at the data to support that. So what's the current view on that in the NFL?
I think from the NFL standpoint, this is one where they've really left up to each individual team. And there is data that interior linemen and linebackers, there's some protective data, particularly for MCL injuries. So each team, particularly at the professional level, have left that to the players to decide. I think at the collegiate level, it becomes a little bit more uniform. And I try to educate the coaches, and a lot of our college coaches will ask, and we give them the data, and ultimately you have if the players want to try them, is a very reasonable thing. The biggest part is the feedback from the athletes. Some athletes feel like they have a hard time performing at the level they want to perform at, versus some feel very comfortable wearing it. And until the data is very concrete, it's hard to say you have to utilize them. So I think at this point, at the pro level, it's been suggestive. At the college level, some college coaches mandate it, but ultimately I think it's probably an individual decision with each athlete as to how they feel the safest performing.
Yeah, it seems similar to like the ACL sport brace, where it's really hard to tell a patient, yep, you have to wear this. But some people say, I just feel better. I just feel more confident, returning to my sport with it. And others are like, when can I throw this out? I hate it.
Right. It's a personal decision.
Yeah. So we've talked a lot about safety and player safety and technology, but we really haven't talked about performance yet and how to optimize performance. So Robin, what examples have you seen technology-wise that the athletes appreciate as far as performance optimization?
I think the wearables. Actually, I'm wearing one right now. I just looked down, but I think all these different wearables, and so again, looking at recovery. They can track everything, right? So they know. I remember during COVID, when one of our players came to us and said my temperature was elevated last night, and the next morning he said it's a little bit higher, and he wound up having COVID. And so just simple things like this. And trying to optimize it and saying, hey, my heart rate's been elevated, my resting heart rate for the past 3 nights, and maybe I'm not recovering well enough.
Yeah, or sleep.
And so I think there are so many of these tracking devices, and that's what I have seen that our athletes have liked the most. But
yeah, Catherine, I would add the players have really bought into this. They want to see how fast they ran at each practice.
It's competition,
who had the
right?
top speed. It creates a little fun internal competition. But then they do see their workloads, and you may find somebody, it's the rapid change in the workload. They may have been a backup player who didn't get a whole lot of playing time, and then all of a sudden the person in front of them gets hurt, and they go in and play, and their workload spikes. And those spikes in workload we know are a risk of injury. That was one of our original papers we published, was that change of your acute and chronic workload ratios really increased your risk of injury. So now our backup players at practice continue to do cardio during the practice, so it's not stand and watch. It becomes an active process where everybody's moving all practice, everybody's always conditioning, so you don't have those spikes in the workload. And the players have bought into that. On the other side of that are our veteran players who have had some injuries and they're at risk, and we monitor them through practice, and boy, they're at the 90th percentile of their typical workload the last 3 days during this drill. Maybe we'll back them down during this drill, or hey, it's time for them to have a rest day. And I think the players have appreciated that. The coaches see the value in it. So it's really improved the ability to keep players safely on the field.
Yeah.
All the recovery things too, the flotation tanks and all the compression and elevation, and I mean there's so many different things to use. And I think the players then watch that and say, oh, my workload's really high, let me go into the recovery room.
And I think that translates to, the community patient too, where, if we're recovering somebody for just an ACLR, at a certain point you're saying to them, they get this spike around like 6 months of I'm more sore, I'm more, like now I'm starting to have all this quad pain, and you have to have that talk of like, okay, you're really increasing your workload now. You haven't really been doing a lot. We've been doing endurance-based exercise, but now you're trying to really hit it harder, and you have to implement all those recovery things. I'm a big fan of recovery. I feel like every little tool I always want for myself. And so speak a little bit about recovery techniques, like what you have in your different facilities, what the athletes find most helpful, either anecdotally, because I think recovery rehab, that's obviously where we really lack literature. So just understanding what you find is most helpful.
It's all anecdotal, I'd say, and it's preference, right? And every player has a different preference.
Totally.
So, again, from the flotation tanks to the sleep rooms, we have some separate sleep rooms. The compression, all kinds of different compression. Those are the ones. Again, the laser, all the laser and the ultrasound. But again, that's player specific, and there's not a lot of data, like you said, and so that's how we use it.
Translating it into the community, I think the three that are therapy locations have been able to utilize. One is contrast therapy, whether using hot and cold tubs or a device to do so. The compression therapies, all of those are the two that people have really liked. And then making sure all of our physical therapists are trained in all the manual therapy techniques, and whether it's dry needling or manual therapy. Those are probably the three big ones that have helped. And interestingly, we've seen in our team, as we've initiated all these recovery devices, we use less anti-inflammatory medicine. People are less sore. So we've really encouraged our patients, even now our post-operative patients, to utilize these modalities, and it's reduced our utilization of medication.
Hyperbaric chambers, but some players will go and use them. We don't have them in our facilities. But.
Like the cryotherapy too, and
So we talked about recovery, but what about ultimately clearance for getting injured athletes back into play? How are you using technology to do that? Like Catherine and I just spoke about with the Bear implant, how we're clearing people to get back in using return to play for like ACL. Are you using any of these advanced technologies to determine that an athlete has biomechanically recovered fully and is safe to go back in?
Yeah, I can give you a couple examples here. One is we use our video technology where now the players do their functional movement screen. We have the video set up at the stadium or at our facility. So pre-season, as part of their physical, they do their functional movement screen. So as they're returning from an ACL or a hamstring, they have to match their functional movement screen. Then we watch them with their GPS data. Are they at their typical acceleration? Have they reached their top speed? And now, thanks to an AOSSM Playmaker grant last year, we use muscle oxygen sensors on our ACL patients, where we're following our patients at 6, 9, and 12 months after an ACL reconstruction with the muscle oxygen sensors on their surgical and non-surgical leg, and watching the body's ability to consume, or the muscle's ability to consume oxygen come back to normal, has really helped to be an internal data point. And now we have 50 patients we've done both with our pro athletes and our youth athletes. So we're not only getting that external movement data, now we can start to get internal physiologic data to help to guide that return to play. So I think that's going to help us to
That'll be great.
marry how to get people back safer.
When will that, do you know when that'll be ready to present?
So it'll be hopefully accepted here for next step. We've had 50 people.
Little plug for you.
Yes, AOSSM will be hopefully it will be accepted to present here next year, and grateful for the grant and really helped us to accelerate the program.
No, it is really exciting. So on the podcast before, we actually had Robin on. This was a year and a half ago, maybe, and we discussed return to play. It's definitely my big passion as far as testing, but I know we're really focused on NFL, but anything with baseball, any other technologies that they're doing that?
Yeah, nothing else really. I mean, the video analysis, that's basically it. So it's very gradual and slow return to play.
Yeah.
So you start off small. It's very small, right? And then and so I think when these players get injured, you always give them the long timeline. That's big.
And when you talked about the video analysis, you talked about like pitchers getting back in after like a UCL to make sure that like their mechanics are good and that they're hiking their leg correctly and empowering their pitch correctly.
Yeah, that's correct.
That's awesome.
Yeah.
And the coaches play a big role, right? So that they're also calling me and saying, "Hey, listen, he looks off." And even though all the testing's positive or is good, and we've cleared him, but someone will call me and say something's not right.
Yeah.
And so, that's great and that's valuable. It's a team effort to get them back.
Yeah.
And I always make a point of that.
Yeah. My main sport to cover is professional lacrosse, and I always thought about, your sideline is a little bit like the OR. You expect people to speak up if they see something that looks a little, awry, like because your eyes are
you
one
can't be
place,
in one spot.
and
I
then
got 2 eyes.
there's some sort of off-ball hit that that you have to pay attention to. So I think it's very similar to the OR, that you just encourage your sort of team to speak up. But as much as we're so focused right now on talking about technology and all the great things technology can do, there's also that just doesn't look right.
It doesn't look right. Yeah.
Yeah.
That intuition.
Yeah, so as far as future endeavors, this is the last things we wanted to hit on. What do you think is coming down the pike? What sort of exciting things are coming with the NFL, technology-wise, or anything that you'd like to add that we can learn about?
I think there's continued evolution in the equipment, so I think we're just seeing the tip of the iceberg in terms of what helmets and shoes and shoulder pads are going to look like. I think that evolution will continue. We're excited to see that, and I think everyone's realized the importance of our equipment, and I think that'll translate to all of our other sports once that occurs.
Yeah.
The other is the utilization of sensor technology, again, to the external data. I think we've gotten pretty good at the ability to do internal data of looking at elements of fatigue, of core body temperature, or lactate, or whatever that other marker may be. The sensors are becoming more and more usable. Nitric oxide consumption, all of those things I think are what's next. And as those sensors are now more readily available and able to use in large quantities, I think that's the next step to get that physiologic data. If you can start to predict, is somebody's body heat, or is their temperature going up, and their lactate, are they getting ready to overheat, or have you started to recognize a cardiac event? So you can imagine doing that at the NFL level. We're working with several companies, and you can imagine being at a giant soccer tournament. If all of your athletes have their core body temperature, heart rate, and that's able to feed to one level, you can pick up, if you're at a soccer tournament with 1,000 kids, as you said, there's only 2 eyes.
Right.
You can sense, is there somebody who's overheating? Is there somebody who has those risk factors coming? I think that's the next thing, and to be able to provide a value add and a safety to all those big club sports events, I think is where it's going. Hopefully we'll get there soon.
Yeah, I hope so too, and I know those athletic trainers would be so happy. It's a lot of people to manage.
It's data, and a lot of times you don't know what to do with it all, right? And so I think that's important too, because people want to have data, but then what do you do with all this information? So I think it's really important as we start to push towards that, especially all this internal data collection, and to say, what do we do with it?
Right.
What does it mean somebody's temperature's elevating and they've been playing for, a 2-hour game, right? And what do we do? Do we pull them? Do we let them continue playing? So I think that's what we have to be careful with.
Yeah, I think that's the most difficult thing, is that when you're not the return to play after someone's already been out, but the return to play mid-game, I don't know, are you okay? It's you have such limited data in that time, and it's difficult. So.
Well, thank you both so much for being here with us today. This
Sorry
has been
we're
awesome.
late.
Oh gosh, no, don't worry at all. This has been
Good
really
reason.
awesome. Like, this is one of the talks I was looking forward to the most,
Me
because
too.
what makes sports medicine so awesome is the development of technology and the advancement of the field to keep our players safe. So this is fantastic. We really appreciate it, and thanks for being
Lucky
here.
to have you.
you.
Thank you so much.
Thanks for hosting us.
Yeah, of course.
Thanks.
Thank you for listening to this episode of the Sports Talks. We hope you enjoyed the discussion as much as we did.
Make sure to subscribe on Apple, Spotify, or wherever you get your podcasts to stay up to date on all things sports medicine. Exciting announcement, we are also now on YouTube. You can find links to all of our social channels and our contact information on our website, www.thesportstalkspod.com. We love to hear from you.